You're listening to the Quint's podcast.
With the entire country in a lockdown since March, with malls shut, offices shut, schools shut, salaries being slashed, people being fired from their jobs, migrants walking back home for want of employment and food, it felt like we were all in this pandemic together. However, a recent report by Oxfam states that India's wealthiest actually escaped the worst of the pandemic and got richer in the lockdown. Sample this, and this is a big number. India's top 100 billionaires have seen their fortunes increase by rupees 12,97,822 crores since March, enough to give every one of India's 138 million strong population a cheque of rupees 94,045 rupees. This pandemic has pinched more than just the pockets of many Indians. It has revealed glaring cracks in our healthcare system, the access to education, the digital divide, and most importantly, how the pandemic had not impacted us equally. So how did the billionaires continue to get richer during a pandemic? And how has income inequality aggravated the general state of inequality in India? And is a reform of our tax code the answer? Answer these questions, we spoke to Amita Behr, who is the CEO of Oxfam India. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. While the super rich have increased their wealth, the inequality virus report by Oxfam states that common and ordinary people will take at least a decade. Yes, a decade to come back to their pre-pandemic level of economic status. On the other hand, some of India's richest recovered all their lost wealth due to the stock market crash in the start of the pandemic within just the 9 months when the country was shut. A stunning figure which the report highlights is that the richest man in India, Mukesh Ambani, actually earned rupees 90 crore per hour during the pandemic. And to get an idea on how much Mr. Ambani's increase in wealth actually was, the report suggests that his wealth alone would have kept 40 crore informal workers out of poverty for at least 5 months. So how exactly did the rich manage to get richer? We spoke to Amita Behr to understand this.
So I would say there was this myth going around that the COVID virus does not discriminate, the impact is going to be equal. That's not correct. What we have seen is that the COVID virus has actually accentuated inequality, and it's accentuated the way inequality functions in this country around gender, around caste, around ethnic lines. So, that's certainly what COVID has done. But your primary question around inequality, yes, I would not say that COVID has created inequality. We have created an unequal economic system. As in, just look at Thomas Piketty. Many years ago, he started talking about inequality in India, and I thought his work was extremely revealing but saddening. One of the things that he reminded us or told us through his research was that India now is more unequal society than what we were pre-independence. And post-independence, we were constantly looking at a move towards a more equal society till the 90s. And post-90s, it started again becoming an unequal society. But now we are a more unequal society than what we were in the 30s. So it's not something that COVID has created, but it certainly has accentuated it. And it's, in a way, what COVID did was it brought out that inequality into the public domain. The whole migrant crisis that we saw with those very powerful but heart-wrenching visuals of thousands and lakhs of people not having food, walking back to their source villages. I think, people were hit hard. Probably people in their daily lives, upper middle class people, don't pay attention to this, but it has brought this whole question to the center stage. Just to also give a sense to the audience of the levels of wealth creation that happened and how it was skewed in favor of billionaires, let me just give you a couple of figures. The first one is the top 10 billionaires of the global list actually added $500 billion to their kitty during the pandemic. Uh, and on the other hand, pretty much every study, including the World Bank recent report, says that common and ordinary people will take at least a decade to come back to pre-pandemic level of economic status. There's one more, which tells you the differential recovery of the billionaires, and on the other hand, of the poor ordinary people. Thousands of billionaires of the world did take a hit initially, but within 9 months had recovered their losses. So that's the difference. And if you look at the question that you're asking, it is around the standard lines of the people who are already rich. It is certainly more of the IT sector. But what is important is that different kinds of people in different sectors who are already rich have made more money. So it is, I would say, an indicator of an economic system which rewards the super rich much more. And as we've been saying, it's more of a rigged economic system which favors the billionaires. Government is not in control. It is actually facilitating this billionaire boom. So, and that's where the idea of crony capitalism comes in, that you're eventually looking at a policy framework which favors the rich. Because ultimately, inequality, and this is what the report has been constantly saying, and our Oxfam has been saying, inequality is not inevitable. It's a policy choice. Where does the government make its investments? What are the policy choices that the government has? That's the critical question to ask. And therefore, I would say it's not a neutral bystander, the state or the government, as you said. It is an active participant and partner of the billionaires in helping them gain more wealth.
As Mr. Behr said, inequality is not inevitable, but depends on policy changes made by the government. Raising taxes on the rich and corporations has been a frequent recommendation by many economists so that everyone pays their fair share and the government also does not lose money due to low tax rates. The Tax Justice Network, an independent international network based in the UK, estimates that countries are losing a total of $427 billion in taxes each year due to international corporate tax abuse and private tax evasions. However, these suggestions are not new to the Indian government. At the start of the pandemic, when majority of businesses and industries were forced to shut down, policy recommendations for increasing taxes were made to the centre and even reached the Prime Minister's office. A policy paper titled The Fiscal Options in Response to the COVID-19 Epidemic contained recommendations like raising the income tax rate to 40% for those who earn more than Rs 1 crore per year and a one-time COVID-19 cess of 4% on taxable income over 10 lakh rupees. And imposing such taxes would have actually reduced the reliance on regressive taxes on consumption, such as GST, which hurt the poor and marginalized disproportionately. India witnessed a mass exodus of people in the months of March and April due to the loss of income in urban areas, and almost 170,000 people lost their jobs every hour in the month of April 2020. As we know, what the government did implement is the Rs 1.7 lakh crore worth Atmanirbhar COVID-19 package, which has been quoted by experts as being grossly inadequate, since it barely amounts to even 1% of India's GDP. But the question is, if we do tax the super rich, would it actually make a difference? One estimate from the Oxfam report suggests that just a 4% wealth tax on the nation's 954 richest families could have raised the equivalent of 1% of India's GDP. Mr. Behr tells us how the redistribution of wealth of the super rich could have sustained the Indian economy during the pandemic and also funded relief packages.
So just to take this figure from this year. Let me give you a couple of figures. This year in India, our report tells us that the top 11 billionaires of this country, and we have 11 because there was a tie at number 10, top 11 billionaires, the wealth they added during the pandemic is enough to sustain the NREGA for 10 years. And you do know that NREGA is one of our most ambitious programs. It is in many ways an embodiment of right to work. So that could have been sustained for 10 years just by the wealth that they have added this year. Another data point is that the same 11 billionaires, if you want to look at, say, the different ministries, they could have sustained the health ministry with their this newfound wealth, added wealth for 10 years. So that's the level of disparity. And just one more, Mukesh Ambani during this period was making 90 crores every hour. Whereas on the other hand, our report tells us that it would take 10,000 years for somebody who earns a minimum wage to earn that amount. Or, uh, you know, the other thing that, just to contrast, because you're trying to get a sense of the contrast, 24% of Indian population, even during pandemic, when our richest man was making 90 crores per hour, they were living with 3,000 rupees a month. 24% of the Indian population, and our population is what, 130 crore now. So say 30 crore people were actually living with 3,000 rupees a month. So that's the level of disparity in terms of numbers.
But of course, inequality is not just a financial issue. It adds to the general inequality in the country by impacting education, access to digital resources, and the most important of all, access to primary healthcare. As India, like many countries in the world, closed its schools, and the government did support the transition of learning to more visual spaces. In our previous episodes, we have analyzed how school students have been impacted due to the pandemic and how does prolonged shutdown of schools affect a student's health. If you have missed those episodes, please check them out on our show notes. But though the government's initiatives were in good faith, Mr. Beher believes that the government has ignored the digital divide and the access to technology.
Uh, in education, we saw that how many, how comfortably the middle classes and the upper middle classes moved to online classes. And there was, this conversation also happening that this is working fairly well. But it does not look at the question of the access to internet, to computers. So if you just look at, say, rural India, in rural India, only, and I'm talking of rural India across classes in rural India, only 4% have access to computers and 15% to internet. So just imagine that how others are getting left out of those online classes. So what you're looking at is a very strong digital divide being created. Let me just take this further. If you look at the bottom 20%, then the access to computers is only 3% and to internet is only 9%, which is further going to accentuate this digital divide. So children from these families are not going to be able to access their online classes, and this would be a wasted year for them. And then on top of it, this whole idea of, one needs to appreciate that very often there are 2-3 children living in the same room with their families. People live in one room houses, so they do not have the space. So in all this, there are studies. Our report is saying that we did a survey a couple of months ago in which overwhelmingly teachers were of the view that there's going to be a serious dropout once the schools reopen. Malala Fund has actually put a number. It says 20 million girls, and in particular, it's talking of, there's a gender dimension to it, that the girls will not come back to school. So you're looking at how different people are getting affected differently.
So, what is the plan to bridge this inequality gap? Will just taxing the rich be enough? Well, introducing radical policy changes is only one of the ways to tackle the inequality. And also, the idea of changing economic models for a country is not theoretical anymore. Countries like New Zealand are prioritizing the indicators of well-being over aggregate GDP growth at all costs. New Zealand focused on improving the life changes of its indigenous population, reducing child poverty, and supporting mental well-being of young people as their top 5 priorities of their budget. And speaking of budget, the Indian Parliament's budget sessions have already commenced from 29 January. What can the government do for poverty alleviation? Mr. Beher weighs in.
In terms of the reforms, I would,
Mhm.
first say that we need a fundamental rethink of how we do our budgets. And just in a simple line, we would want a, a world with less billionaires and more nurses. Can we make that shift? And this is again, as I said, sometimes it's important to give peer examples. New Zealand has actually changed its budget, and now they're calling their budget as a well-being budget. That's what they're doing. So why can't a country like India start looking at that? So to make those shifts, there are 3-4 very specific recommendations we have. The first one is, as you talked of, the relief package for COVID, which was inadequate. I think now the government must ensure that people who have lost their livelihoods are provided direct financial support. I think that's important. The second is a free vaccine to all. It's critical that the disruption that's happened should now not again lead to inequality in terms of access to vaccine. We're already seeing that, as in I've been reading reports about vaccine tourism, not from India, but globally. People are flying to Dubai to get a vaccine, and it's also a holiday for the super rich. Yeah, so a free vaccine to everyone. The second big recommendation we have from this relief, moving from the relief package, and which is very critical, we have seen investments in education and health lead to a more equal society. And there's ample evidence from around the world, established evidence, that investments in education and health lead to a more equal society. And look at India at the moment. This is a pandemic year, and still let me remind you that India is ranked 4th from the bottom globally in terms of its investment in health. So this is just not acceptable. We will need to change that, and we need to enhance our investment in health dramatically, and similarly on education. And it's interesting, government after government, plans after plans. So, for the last 20, 30 years, as in I've been working on this issue, governments promise 3% of GDP on health, 6% on education, and we have not crossed, both put together, 5%. We're somewhere there. So, we are really looking at low investments, which then create more inequality. The third is, I think, looking at the minimum wage. The labor reforms, again, saddening that this was the time when the government should have actually supported the working class. But what we saw was actually dilution of labor laws. When people did not have enough on their plates, we were saying, and almost 10 state governments actually relaxed the number of working hours. And there were several other, in the name of reforms, actually rights of the working people were taken away. So it's important now that we relook at minimum wages, and we must bring in a concept of what we call as living wages. And this is essentially about living a life with dignity. So it's very critical that we ensure everybody gets a living wage, and not just a minimum wage, which will get people only out of poverty, but we are talking of a life of a decent life. And then what is critical is investments in more greener sectors and more people-centered sectors. For instance, agriculture. How do we focus much more on it, which, essentially in sectors where there would be much more job creation. So these are few specific recommendations, but as I said, it is a fundamental shift that the government needs to make, the budget needs to make, in which people are at the center, and it is not the billionaires.
If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.